Hello, I'm Basil Butcher, your brain-based movement conditioning coach. Today we're going to talk about a brain-based approach to rehabbing injuries in terms of enhancing receptor information from the injured area. Oftentimes in rehabbing injuries, restoring receptor input from the injured area is often overlooked. Hence, the person is never fully rehabbed as a result, because the brain works like this. It gets sensory information, it integrates that, and then it acts on it. So it's not getting good sensory information, your movement is going to be compromised. Your movement would not be as efficient as a result, and you might still be in pain. And there are a couple of tracks we get this information from. One is called the dorsal and the anterolateral. The dorsal is on the same side of the injury. The anterolateral is on the opposite side in terms of the spinal cord. And what's also important is that different tracks bring different receptor information. So, for example, you have like light touch, pressure, joint position, vibration, 2-point discrimination. That's like somebody sticking you with something with 2 points and you can't even tell it's 2 points. You keep saying it's 1 point. And then on the other side, you have temperature, hot and cold, and you also have sharp or dull nociception. So I'm going to show you a couple of drills that would upregulate receptor information through the nervous system, so your brain will be getting good information coming from the receptors. The first one, so say for example, I have an injury on my left knee. The dorsal tracts would be on my left side, same side. So what I would do, I would take my left leg across at the back, left arm up. I'm reaching for the ceiling. Keep reaching as I bend. I want to keep reaching as I bend. So I'm elongating my spinal cord as I keep reaching. And then I would breathe in 3 to 5 times on the left side, right? And then the other side for the nociception, the hot and cold receptors, that will be coming up through the contralateral. So I would do it on the right side. So I take my right leg at the back and I reach up just like I did on the left side. Keep reaching up as I bend over, and I breathe 3 to 5 times up and down while doing that. The next one I would do is called air hunger. That means I would breathe in, breathe out, pinch my nose, and do a movement, walking, for example, as much as I can until I need to breathe again. And you repeat that for say about a minute. You do a minute duration of air hunger. And then the last one is what we call anti-saccades, where I'm putting my 2 fingers up like this. I'm looking straight ahead, and whichever finger I move, my eyes shoot to the opposite finger, not to the movement finger. That's called anti-saccades. You can do about 10, 15 reps of those. All of those things, you should see more times than not, you will see an upregulation of your sensory information from the receptors. You can retest, like put a cold pack on one side and the other side. When you retest, you'll find that they're both close to each other. You can poke with like a toothpick or something on both sides. After you've done this, you recheck, you'll find that both sides you're feeling the side that was duller, you're feeling it a lot more, You could take a light tissue and rub it across on both sides. You'll feel the difference there. So those are some of the things that you can test. And you take the vibration, a massager, you put it on both sides, recheck to see if you're feeling it on the vibration the same way. And you will find as soon as you do that, you will be able to feel that joint a whole lot better and be able to express more strength in exercises crossing that joint. So you have any questions, hit me up drop me a DM and we'll talk. Have a good one.